Okay, so we're looking at the clinical cause of respiratory distress syndrome. When you talk about cause is more of like how the disease actually progressed. Okay, so there's a respiratory distress syndrome, but how did it actually move from being mild to worst? Okay, so clinical cause of respiratory distress syndrome, you can actually see it: exudative phase, proliferative phase, then the fibrotic phase. So we're going to discuss each of these phases, how they actually move to the other one. Okay, so clinical cause typically unfolds in 3 distinct phases, each reflecting the progress of lung injury and body's response. So it has to do with this injury has been there for a very long time with nothing to stop it, so it's progressing over time. So exudative phase, which is the first one, timing begins 6 to 72 hours after an incident event. So pathophysiology, there's increased permeability of the alveolar capillary barrier. So fluids usually leak into the alveoli, okay, causing pulmonary edema. There's impaired gas exchange and reduced lung compliance. I see. So clinical features, there's rapid onset of difficulties in breathing. When you lie down, so you have difficulties in breathing. Bilateral infiltrates, that's if they ever do any chest imagings for you. So often requires the person to be supported on breathing. Okay. The proliferative phase, this one now, there's initiation of lung repair. The body is trying to respond to the issue coming in. So there's proliferation of type 2 alveolar cells and fibroblasts. Okay, some edema gets resolved, okay, but the inflammation continues. Okay, so there's gradual improvement in the person being able to breathe, may require ventilatory support. There's risks of complications like barotrauma, or if they are aiding you to breathe, you can now contact some infections in the hospital. Okay, so fibrotic phase is a subset of patients that have acute respiratory distress syndrome for a very long time. So that one now, the cells have been stressed for a very long time that they start dying. So there's scarring of lung tissues, okay, permanent loss of lung function. So clinical features is the persistent respiratory failure may lead to long-term oxygen dependence or ventilator support. There's increased risk of mortality and long-term disability. So overall, the complications is there's improvement in managing respiratory distress syndrome because of how the healthcare system has actually improved. Okay, so but overall, there's reduced lung function, cognitive and psychological impairment. Okay, but by and large, these are the phases of acute respiratory distress syndrome.